Dr. Anand Babu, Orthopedic Surgeon, CARE Hospital, Musheerabad. Today we talk about carpal tunnel syndrome, wherein the nerve, median nerve gets compression at the front of the wrist, and thereby you get symptoms like tingling, numbness in the hand, and also loss of sensation. Sometimes you lose grip strength, you may not be able to grip, and things will fall from your hand, and also sometimes you may lose the sensation in selective parts of the hand. So these are the things that we observe in carpal tunnel syndrome. So usually we diagnose with clinical tests and also with the help of nerve conduction studies called NCV and EMG studies. Sometimes these kind of symptoms also occur in cervical disc disease, like a disc protrusion in the neck can also cause these kind of symptoms. So we have to differentiate this from a cervical disc and a compression at the median nerve at the wrist. So this is distinguished by ordering tests like MRI for the cervical spine and NCV and EMG tests for the nerve conduction studies. So thereby doctor will decide what is the cause of these symptoms. And this commonly occurs in repetitive workers, where they use in repeatedly bending the wrist or extending the wrist in their work, like software engineers or a mother carrying the baby repeatedly in a fixed position. So, and some kind of works like carpenters and plumbers who use the hand lot of times, they get this kind of carpal tunnel syndrome problems. So in short, the treatment first is non-operative, where we ask the patient to wear nighttime splints to keep the wrist in extension, and also we give medicines like pregabalin, gabapentin to reduce the symptoms, and also we give sometimes steroid injections to reduce the swelling in and around the nerve in the synovium. And also if the pain doesn't go away, then we may have to do a small surgery called incision and release, whereby we cut the tissues lying above the nerve, that thereby decompressing the nerve and relieving the symptoms. This is a small surgery which gives substantial relief for the patient. Thank you.